Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
And welcome to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health care agency proudly serving Miami-Dade, Broward, and Palm Beach counties. For more information, visit All County Healthcare at 954-717-7027. I am your host, Dawn Graubert, and I am excited to bring you tonight Dr. David P. Seltzer. Dr. Seltzer is a compassionate primary care physician focused on preventive medicine, chronic disease management, and obesity medicine through NYU Langone Health in South Florida. Dr. Seltzer has developed a chronic care management program supporting Medicare patients with conditions including kidney disease, diabetes, and high blood pressure through ongoing follow-up and personalized care coordination. He also founded an obesity medicine clinic dedicated to sustaining wellness and weight management through medication support, nutrition, exercise, and behavioral guidance. He is a member of the Obesity Medicine Association and serves on the Institutional Review Board of the NYU Grossman School of Medicine, reviewing research involving kidney disease and transplant care. Dr. Seltzer specializes in adult primary care, annual wellness visits, preventive health care immunizations, and comprehensive chronic care support. You can reach Dr. Seltzer at NYU Langone Medical Associates in Delray Beach at 561-495-7787. Welcome, Dr. Seltzer. Thank you so much for joining us.
Thank you so much for having me.
I know we've had a lot of things going on here, a lot of cameras, but it is a pleasure to be interviewing you again. It's been a few years.
It's been a few years, you know, things are going well. NYU is expanding these days. We've added about 15 different doctors over the past few years. Now we're opening up new offices in both in Boynton Beach and in Palm Beach Gardens. We've also added a Boca office. We've really expanded our footprint in the South Florida region.
Which is so interesting because when people hear NYU Langone, it's like, you know, we're in South Florida, it's right. NYU. They brought you down here. You came here just to be a part of this corporation.
Right, I started, this is my completion of my 9th year. Come July 1, it'll be 9 years. I was one of the original guys. I was one of the 2 original doctors who were brought down, me and Dr. Rockland, and we joined the cardiology group under Dr. Snyder, who's our medical director. And slowly but surely, we've built it up. You know, we've seen a lot of growth and a lot of good changes in the Florida region. But overall, more and more of our patients are in South Florida. South Florida has experienced a massive boom in patient population. There's been more of a need for physicians in the South Florida region.
And you're seeing now, you're telling me that you're even expanded, the NYU Langone footprint is expanding to other subspecialties. Yeah,
we've added endocrinology, we've added gastroenterology, pulmonology, we've added orthopedics especially, we added a massive physical therapy program. We're planning on opening up a major tower in the West Palm Beach area. It should be around 7 floors. Wow. Julia Koch was one of the main donors, and we're really looking forward to that opening, hopefully in 2027.
How many different locations are there in the area?
I believe 8 as of now.
That's significant. So they're really taking a stronghold in the healthcare.
I would say that at our annual dinner, it used to be that we could all fit into one room. And this will be the last year. This was the last year that we could all fit in one room.
That's incredible.
Yeah.
And we were talking before we started the show about corporate medicine and different organizations that are acquiring different physician practices. And I see the trend of it ebbs and flows. I've been in the medical community a long time, so they were acquiring, and then the physicians took it back, and then different groups were acquiring. So it's back and forth. You are really enjoying being part of NYU because you say it offers a lot of opportunities to get with AI, to get on other plans. It expands the scope of what you can really reach into?
I would say that as a physician, my goal is to be a physician, not to be a business person, right? I don't have an MBA. I don't want to have an MBA. If I did, I would have went to MBA school. I want to be a doctor, and NYU Langone lets me do that. It lets me focus on treating the patient and the medical care for that patient, not necessarily worrying about the billing and taking care of all the nuances that that are involved in medical care today. So when they have all that corporate business stuff, they're really good at what they do, and they take care of all that so I can focus on the medical care that I give.
And that's what it's about. You went to medical school to treat patients.
100%.
Right? Not to deal with insurance companies.
And I tell them, this is not my role. My role is to tell you the medications are good or bad for you, how that whole thing works out, that I leave to the business side.
Which is great, because I think now patients can come to you and really focus on why they're with you. They don't have to say, here's my insurance, and you're like, oh, let me get it to someone at the front desk. Right. It gives you more clarity of patient care. Like
I talk to my dentist friends, and they're constantly telling me how they're back and forth with patients about cost and whatnot. Yeah. And, you know, with some good luck, we don't have to deal with that, because NYU Langone is an amazing institution, and they are very good at getting insurance companies to pay for care for patients.
And you were telling me how I asked Ed Salazar is here with us, how you became acquainted with All County.
Well, I became acquainted with All County it was around COVID time, and a lot of our patients were getting lung inflammation secondary to COVID and all the pulmonary diseases that were happening during the COVID experience. And he focuses on intrapulmonary percussive ventilation, which really forces patients to get the mucus out, especially our older patient population in the South Florida region, who have a lot of difficulty expelling mucus from their lungs. So by getting rid of the mucus that formed especially in the elder population through percussive ventilation, that helps the patients breathe better, decreases their time to be on steroids, antibiotics, decreases emergency room visits. So really thank you, Ed, for all your care that you give to patients. It's always been our
pleasure. What inspired you to become primary care?
By training, I was a nephrologist. And then around the time of COVID, I actually switched to obesity medicine, as we saw a massive increase in the obesity circuit, and I saw the need for it. Then I went back to some training, and I became certified with the Obesity Medicine Association. I took all the tests, passed them, and it really became a passion of mine.
Now, we all know obesity medicine has changed dramatically with the new introduction of the GLPs for the masses. They've been around in some form, right? But now the masses are able to get them. Mm-hmm. What have you seen the change from when you first started and trained and got certified as obesity medicine to where you are now?
I would say a few things. One is the normalization of it, right? It used to be something that people would say, oh, I take Ozempic, but shh, don't tell anybody, which I never understood, because why are you discussing your medication with other people? Which never made any sense to me. But more than that, I think that people feel more comfortable taking it as it became more and more normative behavior. They also see not just the weight benefit, but the intrinsic overall medical benefits that are there. Meaning, as studies have proven the cardiovascular benefits, the renal benefits, the liver benefits, especially in the semaglutide / Ozempic Wegovy world, those are significant. And then also to help with obstructive sleep apnea, which we see the benefits in the tirzepatide world. So in addition to the weight benefits, you're also getting the metabolic benefits that are there from these medications.
And what would you say qualifies someone to be on a GLP?
So
not just the South Florida people that are like, I need it.
So when you say qualify,
obesity-wise, what are you looking at? Or are you looking at metabolic syndrome?
So I would say that medications get approved for different reasons. So they were initially the Ozempic and Mounjaro were both approved for diabetes. With that noted, Ozempic does also have benefits in regard to kidney disease. It has benefits in regard to liver disease, and it has benefits in regard to cardiovascular disease. It decreases major adverse cardiovascular events. So as a physician, you have to ask yourself, would the patient benefit from this medication? So that's step one. Step two becomes, how is the patient going to pay for it, right? Like, is this affordable to the patient? So now that the Bridge program is coming about, which is starting July 1st, where it should be $50 per month for patients who are Medicare or Medicare Advantage, more and more of our patient population will be able to get it, both if they, quote, qualify, and also if the doctor believes that this will help the patients from a medical perspective.
And then you determine whether it's for kidney, for diabetes, for different cardiovascular or weight loss. So you're looking at the different types of medication or different benefits, right? Whether it's the Ozempic or it's the Wegovy.
So let's start with the injectable world.
Okay.
Right? So in the injectable world, let's break it down between semaglutide and tirzepatide. So tirzepatide has superior weight loss efficacy. So if your goal is to get that patient to knock off some weight, you're going to try to go with the tirzepatide, whether you go with, so that would be in the Mounjaro/Zepbound world. However, if you're thinking about what will help the patient who has cardiovascular disease, who has kidney disease, who has liver disease, you want to try to go with the semaglutide. Now, this is putting aside cost considerations and what the patient technically qualifies for. Okay. So, interestingly enough, when you go into the oral world, which is kind of like a newer medications, right? So Eli Lilly just came out with orforglipron, okay? So despite the fact that in the injectable world, the Eli Lilly drug, i.e. Zepbound Mounjaro, had better efficacy when it comes to weight loss, orforglipron is not as efficacious as its competitor, oral Wegovy. So oral Wegovy will have a greater up to 13.6% weight loss as compared to orforglipron. But everything has a risk and benefit, right? Nothing's perfect. So orforglipron is a non-peptide as opposed to Wegovy, which is a peptide. What is the difference, doctor? So the difference is relatively simple. The orforglipron, you can take at any point in the day. It's much simpler. So even you might lose a percentage or two on the oral pill, right? Overall, it's much simpler for your patient to take, right? As opposed to the oral Wegovy, which has to be taken 30 minutes without eating any food because it works what we call a, quote, snack protein, which is a certain type of molecule that helps break down the medication. So you have to really get to know your patient in order to be able to decide what would be best for them. Some people feel more comfortable by taking a shot once a week. However, some people feel that they need that daily reminder to eat more healthy by taking a pill every day. So each person may feel a little bit differently. There's pros and cons to all different types of medicines. And that's why that close connection with patient and that persistent follow-up is so much more efficacious for the patient population than seeing a, quote, him and hers place or something in that realm, because you need to really know your patient in order to be the best effective doctor for them.
Which is why being with NYU Langone and you have more time to be with patient care and not worrying about all the billing and the paperwork gives you a more opportunity to know your patients, the routine, what they really would benefit from, and what they need. Right,
and I would argue that because of AI these days, right, when you walk into your doctor's visit, because of AI these days, the doctor is not as overwhelmed with the paperwork as they used to. Right? I can tell myself, I walk in there and there's a recorder on through AI and it's recording what we're talking about. And then since we're able to have that more face-to-face interaction, you can really get to know your patient so much better. And really there's so much more facial cues and body language when you're discussing different medications that sometimes got lost in the shuffle of like the need to make sure the paperwork is performed and is correct. Then that we're lucky that we live in a day and age where AI is now being used as a tool to help physicians to help physicians.
All right, we're going to take a commercial break. When we come back, more with Dr. Seltzer on the other side of All County Healthcare, you and your doctor. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to All County Healthcare, You and Your Doctor. I am Dawn Graubert. All County Healthcare is a Medicare certified home healthcare agency operating in Miami-Dade, Broward, and Palm Beach County. For more information, you can find them at All County Healthcare. You can also reach out to them at 954-717-7027. Tonight, I am going to continue our conversation with Dr. David Seltzer of NYU Langone. Dr. Seltzer works with obesity medicine and primary care, and we were talking about the different weight loss, the GLP-1s, and what we're looking at. But as you said, with every good, there's maybe a con. So what are some of the negatives, if there are any, to the GLPs?
So the first negative that happens to all GLPs is weight loss, right? So what happens when you have weight loss, you increase the risk for kidney stones and gallstones. So when patients come to me and say, hey, look, doc, I developed a kidney stone or a gallstone, I'm like, congratulations, you did it, right? Because you don't have the fat saponification, use the big term there, and therefore the stone, calcium, has nothing to bind to, and that increases the risk of kidney stones and gallstones. So when you see that patients who have had rapid weight loss, sometimes they'll develop the kidney stone and or gallstones. Gallstones happen a little bit more often in females and kidney stones slightly more in males. You encourage them to drink more fluids, and then it becomes a risk benefit as far as how much and how long they can continue, or would you rather just try to keep them on a maintenance dose of medication? Other significant side effects, rarely I've had, let's say, one or two patients have had eye problems from it, and that will have with any diabetic medication, that when you have a rapid decrease in the glucose levels, right, you can have some eye inflammation. I think in the, let's say the last 5-6 years that I've been giving these type of medications, I've had one or two patients that have had that. You also may have one or two that could have a kidney abnormalities. Once again, those are more on the quote rare than common side effects. Other, I would say, side effects that could happen is in regard to tirzepatide, they're much more likely to have skin inflammation. So what I tell the patients is to rotate the spots, make sure it's clean, and also to have some hydrocortisone on hand in case they develop some skin irritation. It's much more likely in the tirzepatide world. Another side effect that can happen that you should tell patients about is pregnancy. In our younger women population.
I was going to say not in Medicare.
But in our younger women patient population, because of the weight loss that happens, it increases the risk of pregnancy due to decreased efficacy of birth control. Yes, that was the word I was looking for. So we advise patients to be cautious about that. I've never been sued because a patient got pregnant, but it does increase the risk of pregnancy. And we definitely do see that happen more often. And we actually, if patient is actively trying to get pregnant, they really should be off the medication for 2 months prior to these medications being started, but not everything is perfectly timed, as I would say. Other significant in the oral medication world, your orforglipron does have an increased risk of the heart rate can go up more quickly. So you have to pay attention to that because patients can get dehydrated and they can increase the risk of having cardiac arrhythmias. So in orforglipron, you have to make sure that patients don't develop cardiovascular abnormalities for that medication. Those are, I would say, like your main risks that you're talking about. And then those are things that people aren't common, but the main problem that you're going to face is nausea and vomiting, right? Because what are you doing? You are constricting the stomach. So you constrict the stomach. If people don't change their behaviors, they're going to vomit, right? So if people overeat, especially at first when they start taking that medication, they could have episodes of vomiting. And then what you could have is a chemical pneumonitis, where the food goes directly into the patient's lungs, and then therefore you can get pulmonary inflammation. So those can usually get treated with antibiotics. Other rare occurrences that you can have is where your patient has complete ileus of the abdomen, right? So if you're taking medication that slows you down, there's going to be some risk of complete stoppage, and so then your treatment is either a laxative, right, to get that patient's bowels moving. Some antibiotics like erythromycin will stimulate the stomach to move, and that will help the effects of a paralytic ileus.
And we also talked about medullary thyroid cancer.
So we've never actually seen that. If a patient has medullary thyroid cancer, it is a definitive contraindication to taking the medication. Now, we've never actually seen a patient develop medullary thyroid carcinoma from a GLP-1. We have seen it in rats. So with that noted, we screen everybody to sort of make sure. So it's a relatively rare contraindication, but because it's never actually happened, but we saw it in the mice rat population.
And the injectables versus orals was really interesting. You said certain age populations, like one versus the other, which I would think would be the other way around from what you had told me.
Right. So I actually find in my practice that more older patients actually are more comfortable by taking the shot. And younger people are more okay with taking the pill. Just from a psychological perspective, I think in more of the elderly population are more used to the doctor telling them, hey, take a shot. But the younger patient population, they're sort of more used to taking pills. They grew up taking vitamins. So taking another pill, it kind of looks like a vitamin, it's close enough. So they're more okay with taking the oral pill as opposed to the shot. They feel like they've gotten older at age 32. So I understand.
And what about what you hear? You have to, once on a GLP-1, you're always on a GLP-1. True or false?
In between.
Okay.
I would argue like this. The goal of the GLP-1 is not to be on it forever, right? If your goal is to keep the patient on the medication forever, you really haven't accomplished anything. You are trying to reset that patient's their weight plateau. So once they get to their certain target weight, their goal weight, which can fluctuate, it's not like it's written in stone, we can change it. Your goal is so that they've changed their weight plateau and they've changed their eating habits, and their levels of hunger should hopefully decrease, right? So in the literature, we talk about ghrelin, how hungry the person is, versus leptin, right? How full the patient is. So I'll check the leptin levels to get an idea of their satiety and how quickly and how much they are. And you should see that the leptin levels should actually decrease, right? Because what happens is as patients' weight increases, they develop what we call leptin resistance, right? Similar to, people may have heard this in the diabetic world, what we talk about insulin resistance, right? Patients, you keep giving them more insulin, but it becomes less efficacious. So you start to have to give more insulin and more insulin. So they develop insulin resistance. Here we have leptin resistance. So that's why some people, you're looking at them like, why aren't you full? And the reason is because either genetic or sociologically, they've developed the resistance to leptin, and they're not full. And that's why they're hungry. And people look at them like, what's wrong with you? No, they have something wrong with them. And our goal is to help them. And hopefully, we decrease those leptin levels slowly but surely with weight loss so that they're not as desirable to have food.
And when you pair lifestyle with the GLP, right? So you talk about you're not going to go out and have cheeseburgers every day, all day, and French fries until you're full, right? You want, when we spoke before, we were talking about lifestyle, movement, exercise, healthy eating. All of that has to go into a continuous, better, healthy patient.
Right. Like I know personally, I try to exercise in my garage in the morning. So what I'll do is I'll show the patient my exercise routine from my Ring device. And I'll be like, Lee, if I can get up at 6 a.m., so can you, right? So what I think it's important to exercise because it changes the mindset of the person versus something that has to be passive, quote unquote, not eating, to something that's active where you can do something more about it. And if you actually, in literature though, talk about how the best way to stop weight regain is actually exercise, because it convinces and changes the mindset of a person. Not everything, in the words of Dave Ramsey, is dollars and cents, right? You do things in order to change the way a person thinks about and relates to different aspects of their life.
And you want them to learn to manage their own weight, to have more accountability instead of calling you all the time.
Right.
Although you love to see your patients.
We love to see our patients. We love to help our patients. I work very closely with nutritionists, and I work very closely with physical therapists to help people, because when you tell someone who has never exercised before in their life that they have to exercise, you need to be able to help them more than just go hit the gym. Like, that's ridiculous. You need to be able to tell them to go exercise in an appropriate way that is possible for them. Everything has to be a practical and possible way for somebody.
And what's really nice about your practice is your multi-specialty right there. So should there be a cardiac event or screening, you're able to refer them right within your own practice office to somebody else.
Well, yeah, I mean, our goal is not that the patient has a cardiovascular abnormality right then and there, but
if you need to monitor something, if they're having heart palpitations from one of the medications, right there that you've got someone in the office that can take care of it.
Right, we have cardiologists there. Every time that the office is open, there's always a cardiologist in the office. There's also a gastroenterologist. There's a pulmonologist. There are many different specialties in our office that will help us right then and there.
Incredible.
Yeah, it's a great place. That's why NYU Langone is really a great place to work and to be at, because there's so much specialty and they have so much ability to provide care to our patients that I'm so happy to be a part of that group.
The benefits of AI in the healthcare profession, which is really nice to hear.
Yeah.
What is the best way for people to reach you or find more information about
They can go on our website through NYU Langone Health, and they can just look it up, Obesity Medicine, Dr. David Seltzer.
Check him out. He's up at the Delray office. You can find him. Phone number is 561-495-7787. And to reach out to All County Healthcare, you can find them on the web as well, allcountyhealthcare.com. Give them a call, 954-717-7027, or email them, info@allcountyhealthcare.com. Dr. Seltzer, it's such a pleasure to see you again. Thank you so much. Ed, thank you again. Delroy, a pleasure. And to everyone listening, have a great Thursday evening, and I'll see you next week. Bye-bye.